Hello and welcome to Chapter 21, Poisoning and Overdose Emergencies. We are going to talk about poisoning and alcohol and substance abuse in this chapter, or in this lecture. So let's talk about poisonings. A poison is any substance that can harm the body, and the harm uh, results in a medical emergency. So common poisonings are medications, petroleum products, cosmetics, plants, and food. So some of the effects of a poison, it causes harm to the body based on the nature of the poison, its concentration, the route of entry, the patient's age, and weight and health. So when we look at the patient's age, weight, and health, um, it's kind of like the medications that they take. How well are they going to work if the patient's older? Their liver function isn't that great. Their kidney function isn't that great. Um, the vessels in their body aren't that great. Maybe they're overweight, and it takes a while for that drug to get where it needs to go because of the weight problem. And again, health issues. Do they have a good functioning heart? If they don't have a good functioning heart, then the medication in the bloodstream doesn't get to where it needs to go as readily. Okay. Same thing with poison. Okay, so if they don't have a functioning heart, a good functioning heart, then that poison doesn't get to where it needs to go, and it just kind of sits there, which can cause issues in and of itself, because if it's just sitting there, it's causing issues with the surrounding tissue and everything like that in that one particular area. Damage to the skin and tissues from contact, suffocation, and localized or systemic damage to the body systems. So it's classified by route. Ingested is swallowed, inhaled is breathed in, absorbed is through unbroken skin, and then injected would be inserted through the skin. Okay. So on a pediatric note, your own home, squad building, any kind of public place should be childproof against poisonings. And then we want to share poisoning prevention whenever we do any kind of public event. So school visits, community outreach programs, we're doing that poisoning prevention information. We're passing that out. We're giving those ideas and various things out. Okay, so these are the routes of entry. So inhalation, sprays, cleaning fluid, injection, which is typically drugs. Okay. Ingestion, rat poisons, drain cleaners, and absorption, which would be household cleaners and insecticides. So when we think of a household cleaner that could cause problems being absorbed, we think of like bleach. Okay, bleach is one of those deals that could be in like 3 different categories here. So it can cause problems with inhalation, it can cause problems if it's ingested, and then it can also cause problems if it gets on your skin. Okay, so a child may accidentally eat or drink a toxic substance. They may think, oh, hey, look, it looks like candy. Tide Pods. Okay, I realized that teenagers were eating them, but children were getting into them and being like, because it's a little square piece of thing. It looks like candy. It's bright, colorful. Looks great. The problem is that they may accidentally eat it thinking that it's candy. Teenagers are just stupid, and they decided to eat it all on their own. Adults, it's often accidental or deliberate medication overdose. If it's deliberate, obviously, they had ulterior motives. And while we need to look at the overdose as an overdose of an ingested poison or something like that, we still need to address their mental issues as well. Okay. All right, so patient assessment. We're going to ask a lot of questions to this patient. We want to know why this patient took the medication, what substance was involved. We want to look for that container. We want to check labels and transport to the hospital with the patient to the hospital as appropriate and necessary. Okay, if we don't need to transport it, then don't. All right. When did the exposure occur? We want to know when, because we need to know if it has a quick acting poison that requires faster treatment. We also want to know so that the ER can do the appropriate testing and treatment for that patient. We need to know how much was ingested. So estimate missing pills by looking at the prescription label. So say they had a prescription that was filled 3 days ago for 90 pills, and they're supposed to take 1 pill a day, and there are 60 missing. Obviously, that's not right because there should only be 3 missing. All right, so we want to do that. I have sat there and counted out pills before to find out if there were any missing pills, because there are some times where your patient will tell you they took something when they really didn't. So we've got to figure out if they did take it, because I need to know how to treat them. If they didn't take it, hey, great. But if they're telling me that they took it and they didn't take it, then I'm going to treat them based on, what I find. And if they are telling me that they took it, then there's a couple different options I have to treat them. Some things could be harmful. Okay. So I definitely need to know if they took it or not. So yeah, I'm going to sit there and count up pills. Over how long of a time frame did the ingestion occur? So treatments may vary. Was the medication taken for the very first time, or has it been taken chronically? So if a patient is taking a medicine chronically, that means that the amount of medicine in their system that they need to get the desired effect takes more. Okay, so if I'm taking ibuprofen over time and I've taken it for years, okay, my body is used to it. I take it daily. I don't really take it daily, but just say I take it daily, and I take that medicine daily, or that ibuprofen daily, and over the course of 10 years, I am upping my dose towards the end of that 10 years, okay? Because, I maybe started out with 1 or 2 pills at first, and then I just continually upped my dose to, 6, 7, 8 pills a day, because my body gets used to that amount of medicine, and once my body gets used to that amount of medicine, it's not doing anything to help with whatever I'm taking the ibuprofen for. Okay, so it's the same way with any kind of other medication. All right. However, if it's being taken for the very first time, like when I started out taking that ibuprofen, 1 or 2 pills worked. All right. So if they overdosed, I need to know if if this was that very first time taking it, or if it's been taken chronically. So that way I can determine how potentially bad the situation is going to be. So what interventions have been taken? So I want to know if they did anything as far as treatments indicated on the label, if they tried any home remedies, milk, syrup of ipecac, water. I want to know if they did any of that. Did the patient vomit after any of these things? Because everything that is technically, all of that syrup of ipecac is supposed to induce vomiting. Okay. So did they induce vomiting? I want to know what exactly happened to try and get the medicine out if they attempted to. And then I want to know what the patient's estimated weight is. So this affects, the weight affects the rate of onset of those toxic effects. the rate of onset. So that rate of onset for those toxic effects. So if the patient, again, is a heavier person, then that medicine or those toxic effects aren't going to take hold quite as fast because it's got a lot of blood and a lot of tissue to go through. All right, so what effects has the patient experienced? Have they had nausea, vomiting? Are they altered? Have they had abdominal pain? Do they have diarrhea? Do they have any chemical burns around the mouth? If they drank bleach, that would be a good indicator that chemical burns around the mouth, and any unusual breath odors. Okay, so food poisoning. This can be caused by improperly handled or prepared food. Symptoms include nausea, vomiting, abdominal cramps, diarrhea, and fever. It can occur within hours of ingestion or a day or two later. I've had food poisoning. It is not fun. It happened to me within 30 minutes of eating whatever it was I ate. And I was down for the count. Like, I was white. I felt absolutely nauseated. I had the cramping feeling. I didn't have any diarrhea or fever, but man, I was sick like none other. It was bad. So activated charcoal, this works through absorption, allowing substances to attach to its surface. It's not an antidote. But it prevents or reduces the amount of poison absorbed by the body. So activated charcoal is something that we have on the truck that we can give for poisonings and overdoses if necessary. Okay, so many poisons, but not all, are absorbed by activated charcoal. Medical direction will determine whether the use of the substance is appropriate. We have a list that we use to figure out if it's appropriate or not. So activated charcoal versus syrup of ipecac. Traditionally, syrup of ipecac is the preferred treatment of choice. It induces vomiting in most people with one dose. However, it has the potential to make the patient aspirate and only removes less than 1/3 of the stomach contents. We don't have syrup of ipecac on the trucks. We used to carry it even up as close as like 3 to 4 years ago. But we do not carry it anymore. It's just one of those things that it's not an effective means. Okay, and anymore they're telling you not to induce vomiting on these patients. Okay, so dilution. This is another option that we have. You can dilute. In an adult patient, they should drink 1 to 2 glasses of water or milk. Children should drink 1.5 to 1 full glass of water or milk. The water may slow the absorption, but the milk will soothe that upset stomach. And it's frequently advised for patients who maybe don't need transport. So, yeah. Antidotes, thought of as a substance that will neutralize the poison or its effects. Very few genuine antidotes exist. Narcan directly reverses narcotics depressant effects on level of consciousness and respiratory drive. This does not take the high away. Okay, all it does is it returns the respiratory drive to where it needs to be. Okay, we may have to give more Narcan over time because it's not actually taking the high away. That high is still there. It's just a different kind of high. Okay. All right. So ingesting poisons, we want to first take standard precautions, quickly gather any information. And when a patient has ingested a poison, it provides another reason to avoid mouth-to-mouth contact. Again, I'm not using my mouth on any kind of patient unless it's my own wife or my kids. All right. And we want to provide ventilation through a pocket face mask. If you're on an ambulance, you've got a BVM right there available. So whip that bad boy out and start giving ventilations. Call medical direction on the scene or en route to the hospital. And if directed, administer that activated charcoal. You may wish to administer the medication in an opaque cup that has a lid with a hole for a straw. It is not fun. It's thick. It's nasty. It's gross. Okay. Position the patient for vomiting and save all vomitus, and have suction equipment available. By the way, I hate vomit, and I particularly don't want to see it. I hate it. It's the one thing about my job that I cannot handle. Inhaled poisons. So common types of inhaled poisons are carbon monoxide, ammonia, chlorine gas, agricultural chemicals and pesticides, and carbon dioxide. Scene safety. We want to approach the scene with caution. Protective use, protective clothing, and SCBA may be required. If not trained or equipped, call for additional resources. Okay, so we're going to remove the patient from the source of the poison. Typically, if it's obvious that it's carbon monoxide, then we don't want to go in. We want to let fire go in, because if we go in, then we're just harming ourselves. Okay. Signs and symptoms of inhaled poisons: difficulty breathing, chest pain, coughing, hoarseness in the voice, dizziness, headache, confusion, or altered mental status, seizures. So we want to know what substance was involved, when did the exposure occur, over how long did the exposure occur, what interventions has anybody taken, did someone remove the patient or ventilate the area, and what effects is the patient experiencing. So we want to move the patient from the unsafe environment using trained and equipped personnel, detect and treat immediately life-threatening problems in primary assessment, perform that secondary assessment, and obtain vital signs. Administer high flow O2, transport all containers, bottles, and labels if appropriate and safe to do so. Perform reassessment en route. Okay. Carbon monoxide is a colorless, odorless, tasteless gas created by combustion. It can be caused by improper venting of fireplaces, portable heaters, generators, and it's the common cause of death during winter and power outages. Signs and symptoms include headache, especially a band around the head, dizziness, difficulty breathing, nausea, cyanosis, altered mental status, in severe cases, unconsciousness. Patients will also get like a red flushed face. Okay. Special monitors are needed to detect the presence of carbon monoxide. Treatment. So the patient may begin to feel better shortly after being removed from the dangerous environment. We're going to administer 100% oxygen and transport to the hospital. It takes time to wash out that carbon monoxide from the bloodstream. Smoke inhalation. So smoke from burning materials can contain poisonous and toxic substances, including CO, ammonia, chlorine, cyanide, substances that can irritate the skin and eyes, damage the lungs, and progress to respiratory or cardiac arrest. Signs and symptoms: difficulty breathing, coughing, difficulty speaking as well, smoky or chemical smell on the breath, black carbon residue in the mouth, nose, or sputum, singed nasal hair or facial hair. I'm going to add in there coarse voice, hoarseness, raspiness. Okay. Treatment: we're going to move the patient to a safe area if it is okay for us to do so. We're going to assess the patient, maintain airway, provide high concentration oxygen, monitor the patient closely, and airway burns may lead to swelling of the airway. If they have the singed nose hairs, they have the black around the nose, then we definitely want to monitor those patients very, very closely, because their airway will eventually eventually close up, and because of all the swelling around the area. Remember back in allergic reactions, what happens when that foreign body gets into the body? All of the tissue around the airway swells up because it's trying to prevent any foreign body getting down into the airway. It's the same concept. So detergent suicides. This method of suicide started in Japan and is becoming more and more common in the United States. It's a mix of two easily obtained chemicals to release a toxic hydrogen sulfide gas, and it's commonly released inside the enclosed space, such as a car. Scene safety. Exposure to fumes may injure EMS personnel. A warning note may be left on the vehicle, but not always assured, and may need to treat as a hazmat scene first. Absorbed poisons. So these can be absorbed through the skin. They may or may not cause damage to the skin, and the patient may require decontamination prior to treatment. Okay. Again, we want to ask all of these questions. What's the substance? When did it occur? How much of the substance was the patient exposed to? Over how long a period did the exposure occur? What interventions did anyone take? And what effects is the patient having? So we're going to assess for immediate life-threatening problems in the primary assessment, perform our secondary, and obtain vitals. Remove the powder, remove any powder by brushing it off with a gloved hand and irrigating with clean water for at least 20 minutes during transport. They should have all been doing that beforehand, because if they carry that like on a farm or anything like that, they know what the problem is, and they can start getting that taken care of. Transport all containers, bottles, safety data sheets, and labels from the substance, and perform reassessment en route. Injected poisons. The most common are illicit injected with a needle and venoms of snakes and insects. Poison control centers are an excellent resource. Information on poisons, signs and symptoms, and treatments. We want to follow local protocol for contact procedures. So poison control centers are great. In our area, and the way we work is that dispatch will get the phone call that get the 911 phone call that, hey, somebody took something here. They'll try and get as much information about what they took before we get on scene. They will actually call the poison control center for us and get the information that we need from the poison control center. They'll put it in our dispatch notes, so that way we have it before we ever get on scene, hopefully. And then they will also call the hospital and give them the update from us and from poison control, and give them contact for poison control on who they contacted. So it's really kind of a seamless procedure. Alcohol and substance abuse. So many patients whose conditions are caused either directly or indirectly by alcohol or substance abuse. Abuse of alcohol and other drugs crosses all geographic and economic boundaries. Potent drug affects the central nervous system. Okay, it can be addictive. Emergencies may result from recent consumption or years of abuse. Treat these patients as any others. And abuse can lead or worsen other medical conditions. So alcohol is often consumed with other drugs, which can result in a serious medical emergency. Alcohol is a depressant. So um, when that depressant kicks in, if they take like Xanax or any kind of other depressant, then it just bogs their system down. Impaired patients can be uncooperative or combative, and we want to contact law enforcement if safety is a concern. So signs and symptoms of alcohol abuse is alcohol odor on the breath or clothing, swaying or unsteady on their feet, slurred, rambling speech, flushed, complaining of being warm, nauseated, vomiting, poor coordination, slow reaction time as well. Blurred vision, confusion, hallucinations, visual or auditory, lack of memory, and altered mental status. Alcohol withdrawal is the abrupt cessation of drinking, which may cause some alcoholics to suffer from delirium tremens or DTs. They can be serious, resulting in tremors, hallucinations, and seizures. Signs and symptoms of alcohol withdrawal include confusion and restlessness, unusual behavior, hallucinations, and gross tremors of the hands. Profuse sweating, seizures, hypertension, tachycardia. So many patients have lots of medical conditions, and those medical conditions may mimic alcohol intoxication. Diabetes being one of those. Strokes being another one of those. Okay. Intoxicated patients may also have medical problems. So we have to remember, we've got to, when we think that it's just a drunk, we've got to figure out, is it really them being a drunk, or do they have an actual problem? Okay. All patients receive full assessment regardless of suspicion of intoxication. So vomiting is common. Standard precautions are essential. Keep suction ready. Stay alert for airway and respiratory problems. Be alert for changes in mental status. Monitor vital signs. Treat for shock. Gather history from the patient or bystanders. Stay alert for seizures. Transport the patient to a medical facility. Substance abuse. This is any chemical substance taken for other than therapeutic or medical reasons. It includes uppers, downers, narcotics, hallucinogens, and volatile chemicals. Okay. The sheet right here. Okay. This sheet. What they'll actually do is put it up underneath their tongue, and the drug is actually the writing and the stuff on the sheet itself. So uppers are stimulants that affect the nervous system. Cocaine, amphetamines can be snorted or smoked or injected. Uppers, so signs and symptoms of an upper use. Excitement, restlessness, increased pulse and breathing rates, sweating, hyperthermia, no sleep for a long time, possibly days. These people are your meth heads, your meth users, and various other kind of uppers. So bath salts are in there. Let's see. Those are the big ones. I feel like I'm forgetting one, but those are the big ones right now that I can think of. I had a guy when I worked in Springfield who was on bath salts. He'd been awake for 3 days. When we got to him, he was naked walking down the middle of a major road in Springfield. And he said that he had been awake for 3 days. He was hot. He couldn't get cooled down. We ended up starting an IV, putting cold packs in him, and transporting him to the hospital. But yeah, he was pretty bad off just from bath salts. So downers, these are central nervous system depressants. That includes barbiturates, Rohypnol, GHB, Signs and symptoms include sluggishness, poor coordination, decreased pulse, and respirations. Narcotics. This is used to relieve pain or help with sleep. Opiates, heroin, codeine, morphine, oxycontin is the biggest one that most people abuse because it's so easily available. Fentanyl is another one that gets abused a lot. So signs and symptoms of narcotic overdose or abuse. Reduced rate of pulse and rate and depth of breathing. Lethargy, being very sleepy, pinpoint pupils, profuse sweating, and coma. Hallucinogens create an intense state of excitement and distorted perception. So LSD, PCP, ecstasy. Signs and symptoms include rapid pulse, dilated pupils, flushed face, seeing or hearing things. Volatile chemicals, so they produce vapors that are inhaled. Initial rush can act as a central nervous system depressant. Signs and symptoms include dazed, disoriented, may develop a coma, swollen membranes in the mouth, nose, or mouth. Membranes in the nose or mouth. Funny, numb feeling or tingling inside the head, changes in heart rhythm. So volatile chemicals produce those chemicals. Huffing or bagging. Typically these, if a patient is going to huff them or somebody's going to huff them, they're going to do it right from the can. So spray paint, the enamel back there that he's huffing. Let's see, rubber cement, whipped cream, the canned whipped cream, any of those things, those are all volatile chemicals and can be huffed. So the patient it may be difficult to do a patient assessment. Depends on the patient's level of consciousness and that the patient may have taken more than one type of drug. The patient may be uncooperative or combative, and we need to be aware of a possibility of contaminated needles and the presence of those chemicals. Be aware of possible airway problems, respiratory distress, provide oxygen and assist respirations as needed. Treat for shock, talk to the patient to keep them calm and cooperative. Perform the physical exam, look for evidence of injection sites, track marks. Okay, so these are track marks right here on her arm. They're pretty obvious. So here, there's one here too. Here. Okay, those are all track marks. Transport as soon as possible. Consult with medical direction according to local protocols. Perform reassessment with monitoring vital signs. Continue to reassure the patient throughout all phases of care. All right, so let's do some chapter review. In a poisoned patient, perform a primary assessment and immediately treat any kind of life-threatening problems. Ensure an open airway. Administer high concentration oxygen if the poison was inhaled or injected. Next, perform a secondary assessment including baseline vital signs. Find out if the poison was ingested, inhaled, absorbed, or injected. What substance was involved. How much poison was taken in. And when and over how long a period. And what interventions others may have already done. And what effects has the patient experienced. Consult medical direction. As directed, administer the activated charcoal, water, or milk for ingested poisons. They're probably going to defer to the Poison Control Center as well. Remove the patient who has inhaled a poison from the environment and administer high concentration oxygen. Remove poisons from the skin by brushing off or diluting them. Transport the patient with all containers, bottles, and labels from the substance. Reassess the patient en route. Carefully document all information about poisoning, interventions, and patient's responses. All right, so let's do some critical thinking. So this is your scenario. A farmer calls 911 because of one of his farm hands has tried to clean up spilled pesticide powder with his hands. On arrival, you find that the patient insists that he has brushed all the powder off, feels fine, and doesn't need to go to the hospital. So, let's go forward. So as he talks, he continues to make brushing motions at his jeans, on which you can see the marks of a powdery residue. How do you manage the situation? So in this situation, you're going to do as much as you possibly can to make him go, to get him to go, to convince him to go. While it's not a true medical emergency at this time, it can turn into that within 10 minutes, within 30 minutes, within an hour. If nothing else, we're going to try and, help him brush those chemicals away, and then get the genes off, do some flushing of the skin and various things like that. All right, so if you have any questions, let me know. You can call me, email me, text me, and I will answer those, and I will see you in the next lecture.